Welcome to the training on the Continuity Assessment and Record Evaluation, also known as the CARE tool. This training was originally developed by the American Healthcare Association and the National Association in Support of Long-Term Care for their joint work group to measure therapy outcomes. AHCA and NASL gave permission for Optima Healthcare Solutions and Rehab Resources and Consulting to update the training materials so it could be used by a larger part of the rehabilitation industry who is interested in finding an outcomes tool that will enable them to measure and improve upon rehabilitation outcomes. This is the second of 3 trainings in the series. In order to make your training session more meaningful, you should have with you the CARE Item Set Training Manual. Within this manual is a lot of helpful information. The CARE item rating definitions to be used for the self-care items can be found on page 3 and 4. A chart that defines each CARE self-care item as well as each CARE rating for that self-care item can be found on pages 6 through 13. And at least 2 or 3 clinical vignettes for each CARE self-care item that illustrates how the ratings would be applied in a clinic setting can be found on pages 29 through 37. Finally, you will be required to take the CARE item post-test. This test will test your knowledge of the material presented. Why is this training necessary? The training and test ensures that you, the therapist, understands what each CARE item includes and does not include. As therapists, we may have different ideas about what is included in the task of eating or in the task of toilet hygiene. This training will define exactly what functions the self-care tasks or items include so we can all measure the same thing. The training will also provide each therapist examples and a clinical algorithm to use when scoring each CARE item. It is important to ensure that each person using the tool understands the definitions of the CARE self-care items and how the CARE rating scale applies to each item. Because everyone is receiving the same training, the ratings are more consistent. It also ensures the data collected is consistent. One of the project's goals is that we can begin to assemble a database of information across companies and across the nation so that we can truly measure clinical outcomes for our patient populations. This first step in accomplishing that goal is to have consistent item sets and consistent measurement scales. It is worth repeating that even if a particular task or item is not going to be the focus of your therapy program, you still must score those items. The CARE item scores add up a composite score of the patient's overall function, so if items are left not scored, then the patient's overall level of function in self-care and mobility will be lower than they should be. When we score tasks or items as NT or not tested or NA, not applicable, we downplay the role we have on a patient's overall level of function. So while we have alpha scores for those times when it is just not appropriate to assign a numeric score, keep in mind that these codes should be used minimally. You see on this slide and on page 5 of your training manual the list of items that make up the CARE item self-care set: eating, oral hygiene, toilet hygiene, upper body dressing, lower body dressing, washing the upper body, shower or bathing self, and putting on and taking off footwear. The general format of this training will follow this. We'll have a description of the task, followed by the rating scale for the item, followed by some examples of applying the rating scale to the item. Keep in mind that there are additional clinical vignettes for each of these tasks in your manual, but we won't be going over all of those examples today in the training manual. The first self-care item is eating. This item is defined as the ability to use suitable utensils to bring food to the mouth and swallow food once the meal is presented on a table or tray. Food consistency does not factor into the scoring, so whether a patient eats regular food or a modified diet, the same scoring scale is used. This item is not about the patient's swallowing function, nor about the consistency of food eaten. It's also not about whether the patient uses adaptive utensils or equipment. The rating is chosen based on the amount of assistance provided by the helper. One coding tip is that if the patient receives tube feeding, the rating for this item would be N, or not applicable. This is an example of the rating chart in your training manual for eating. You can find it on page 6. The tables are all oriented the same. In the first column on the left-hand side will always be the description of the task. In other words, how is it defined and what subtasks are included. The next 6 columns correlate to each of the rating levels. Each column represents one of the 6 care item ratings, and their definitions are repeated in bold font for each item. In each column are examples of when that rating might be applied to the task. Examples of clinical application that might qualify for that rating are listed, but keep in mind it is not an exhaustive list. You may encounter situations that are not listed here, so it's important to always use your best clinical judgment. So what would a rating of 4 potentially look like for eating? Look at the table. First, we have a definition of 4. If cueing and/or coaxing and/or supervision are provided throughout a meal because of safety concerns about swallowing, possible choking, and/or eating in a hurry, but no physical assistance, then 4 would be the appropriate score. Or if the helper must verbally guide the patient in completing the task and/or provide touching or steadying assistance to the patient to scoop food onto the utensil and bring it to the patient's mouth. Whereas a rating of 3 would be appropriate if the helper provides less than 50% of the effort in physically assisting the patient in scooping the food onto the utensil and bringing it to the patient's mouth, or conversely, if the patient can partially scoop food onto the utensil and partially bring the food to the mouth, but is unable to complete the task without physical help from the helper. Let's look at example number 1. Mrs. B requires help to cut her food in open containers. She is able to scoop food onto the utensil and bring it to her mouth. She requires occasional verbal cues to take smaller bites and tuck her chin when swallowing. So what would be the care rating level for Mrs. B? The best choice is 4. Since Mrs. B requires a helper, she cannot score above a 5 or supervision. But since she requires occasional verbal cues to safely swallow, the appropriate care tool rating is a 4. Example number 2 is Mrs. P. She is on a mechanical soft diet with nectar-thick liquids. She is able to manage a few bites herself, but quickly fatigues and spills greater than 75% of the food when getting it from her plate to her mouth. She requires a helper to get food on the fork and provide support to her arm to move the fork from her plate to the mouth. So what is the care rating level for Mrs. P? The best rating score is 3. She is able to complete a few bites independently, but then requires some physical assistance with getting food onto her utensil and with lifting her arm to her mouth in order to be able to eat her food. The next care item is oral hygiene. It is defined as the ability to use suitable items to clean the teeth. If a patient has dentures, then it includes the ability to remove the dentures from the mouth and replace them in the mouth, as well as managing the equipment for soaking and rinsing. This item is not about whether the patient brushes her teeth in sitting or standing, nor about the level of assistance needed to get to the bathroom. One tip is to apply the same rating and thought process regardless of whether the patient uses a conventional toothbrush or an electric one. The rating scale for oral hygiene is on page 7 of your training manual. As described before, the column on the far left defines the item. The next 6 columns correlate to each of the rating levels. So let's look at the description of rating 2, substantial or maximal assistance. You might have a patient who can bring his or her toothbrush to their mouth, but needs a helper to assist with applying toothpaste and completing oral care with the toothbrush. Or the patient can remove or replace their dentures, but the helper is required to manage equipment for soaking and rinsing. Or maybe they can manage some equipment, but they're unable to safely or fully remove dentures or replace them for a proper fit. Or The helper may provide guidance to the limb and provides greater than 50% of the effort in assisting the patient to clean their teeth or remove or replace dentures. Let's look at example number 1. Mrs. R wears dentures. She is able to remove them from her mouth. A helper sets up the equipment for rinsing and soaking. Mrs. R can then clean her own dentures. Mrs. R can place her dentures in her mouth, but requires the helper to apply some pressure to ensure they are fitting snugly in her mouth. So what is the best care rating level for Mrs. R? The best choice is a 3, partial or moderate assistance, because just as we discussed in the previous slide, Mrs. R requires the helper to provide less than 50% of the effort in assisting her to replace her dentures. The next example is Mr. Z. He requires steadying assistance to get to the bathroom. The helper applies toothpaste onto his toothbrush and hands it to Mr. Z. Once Mr. Z is done brushing his teeth, he is reminded to wash his face and hands. The helper provides steadying assistance as he walks back to his bed. What is the care rating level for Mr. Z? The best answer is 5, setup or cleanup. The helper provides setup assistance by putting toothpaste on the toothbrush so that Mr. Z can brush his teeth. The fact that assistance was provided in getting him to or from the bathroom should not be considered in scoring oral hygiene. The next item is toilet hygiene. It is defined as the ability to maintain perineal hygiene, as well as adjusting clothing before and after using the toilet, commode, bedpan, or urinal. If a patient has an ostomy, the patient must be able to wipe the opening, but not manage the equipment. This item is not about how the patient gets to the toilet or gets on or off the toilet. It is also not about the level of assistance needed to get the bedpan or the urinal positioned. It's important to review this item definition thoroughly and regularly, since it may be different than definitions of toilet hygiene on other rating scales you have used. You may also find the need to use other sources of data to complete this item, but be wary of relying too much on CNA reports or notes for this item, since they may be providing more help than is necessary. This rating system is about the patient's usual performance, not the worst or the best. The rating scale for toilet hygiene is on page 8 of your training manual. The difference between a rating of 4 and 5 for this item is, again, the difference between providing help during the activity versus before or after. When a patient needs prompting or cueing to complete a task or for safety, then the rating is a 4. But if the patient only needs the helper to help them before or after the task, such as handing the patient the toilet tissue or placing the bedside commode by the bed or emptying the urinal or bedpan after toileting, the best response would be a 5. Let's look at example number 1. Mr. G cleansed himself and adjusted his clothing before and after using the toilet. He did these tasks independently, but held onto a grab bar to maintain his balance. What is the care rating level for Mr. G? The best response would be independent, or 6. He was able to perform the toileting tasks independently with the assist of specialized equipment, in other words, the grab bars. Example number 2 is Mrs. P. She has urinary urgency. As soon as she gets in the bathroom, she asks the nursing assistant to lift her gown and pull down her underwear. After voiding, Mrs. P wipes herself and pulls her underwear back up. What is the care rating level for Mrs. P? The best choice is 3, partial or moderate assistance. The rationale is that the helper provides more than just touching assistance. The patient does more than half of the effort, but the helper does need to provide less than half of the effort. The patient does 2 of the 3 toilet hygiene tasks. Remember, there are more examples for this item in the training manual. The next item is upper body dressing. It is defined as the ability to put on and remove a shirt or a pajama top. It includes buttoning, snaps, ties, or any other closure mechanism if that is applicable. This item is not about putting on and removing clothes that the patient usually does not wear. In other words, ask yourself if the patient usually wears a bra or a pullover. If the answer is yes, then consider that, but if they don't, then it is not included. Remember, this is about the patient's usual clothes, not what the therapist thinks they should be wearing. A few other tips for scoring is that the patient can be in a sitting or standing position. The item does not indicate which it has to be. A simple method of assessment for this item during evaluation is to ask the patient to put on a shirt or a pajama top, fasten it, and then remove it. And as always, consider the patient's usual performance, not their lowest. The descriptions for this item can be found on page 9 of your training manual. When scoring, consider all of the elements of putting on and taking off upper body clothing when considering the plus, the greater than, or less than 50% assistance level. For instance, a rating of 2, substantial maximal assistance, might look like the patient is able to bring the garment together once it is put on, but is unable to fasten, snap, or button it. Or maybe the patient is able to get one arm in and out of the sleeve, but not both arms. Or the patient is able to place the shirt without buttons over their head, but is unable to thread either arm through the sleeves. Let's look at example number 1, Mrs. G, who wears a bra and a sweatshirt on most days. Mrs. G threads her arms through the bra straps and the helper hooks the bra. Mrs. G puts her sweatshirt on without any assistance. So what is the care rating level for Mrs. G? The best answer is partial or moderate assistance, because the helper provides assistance with upper body dressing, but the patient performs more than half of the effort. Example number 2, Mr. X. He sits on the side of the bed to dress his upper body. He threads his arms through the sleeves of his button-down shirt, but requires steadying as he leans to his left side to ensure he does not fall over. So what is the care rating level for Mr. X? The best answer would be 4, supervision or touching. The patient can dress his upper body, but requires occasional touching to steady himself as he leans to his weak side, and that's necessary for safety reasons. The next item is lower body dressing. It is defined as the ability to dress and undress below the waist, including fasteners. This item, however, is not about putting on footwear, nor is it about putting on and removing clothes the patient usually does not wear. So think about whether the patient usually wears a belt. A few tips for scoring is to keep in mind the patient can be in sitting or standing. That does not impact whether or not the patient scores independent. The patient can be independent with dressing their lower body in sitting, but moderate assistance to dress their lower body in standing. But what matters is that they complete the functional item in one of the positions. Another tip for assessing the item is to ask the patient to put on pants, fasten, either through button or zipping, and then remove them. And as always, consider the patient's usual performance, not the lowest. The rating scale is on page 10 of your training manual. A patient would be best scored as 5, the setup or cleanup, if they only have to be handed their garments or handed assistive equipment to help them. Also note here that donning and doffing a prosthesis is not included in their rating of their ability to dress. So perhaps they need a helper to put on a prosthesis, but once it is on, the patient can then dress themselves. They would still be given a score of a 5. Let's look at example number 1. Mrs. Z can be impulsive and has a history of falls. She requires supervision when standing to pull up her underpants and pants. So what would be the care rating for Mrs. Z? The best rating is 4, supervision or touching, because the helper does not provide any physical assistance but is required to supervise the patient due to safety concerns. Example number 2 is Mr. B. He is unable to remove his pants or underpants independently. Once he is lying down in the bed, however, he can unfasten his pants. He can roll slightly to his right and left and assist the helper to pull his pants over his hips. He can lift each leg one at a time so the helper can remove his pants and underpants. So what would be the care rating level for Mr. B? The best response would be 2, substantial or maximal assistance. The helper performs physical assistance for more than half of the tasks of lower body dressing. The patient does participate some in the task by unfastening his pants and assisting with pulling his pants down over his hips. The next item is washing the upper body. It is defined as the ability to wash, rinse, and dry the face, hands, chest, and arms while sitting in a chair or bed. This item is not about washing the back. That is not included in this item, so that's an important point to consider and may be different than other scales you have used. This item is also not about whether the patient can wash his upper body in a tub or a shower. So remember that the patient is in a sitting position for scoring during evaluation, and consider the patient's usual performance. If there are physician orders not to get these areas wet, and/or the patient has medical equipment that precludes them from getting their upper body wet, the rating would be NA, unless, of course, the rating can be inferred from dressing upper body. The rating guide is on page 11 for washing upper body. For this item, a rating of 4 would be given if the helper is providing prompting and cueing for sequencing to fully accomplish washing, rinsing, and drying, or if there are concerns about safety and/or thoroughly washing all areas which require verbal cues from the helper, or perhaps touching or steadying is required for balance and safety when reaching for the washcloth, the faucet, or the towel to prevent falling, or to enable the patient to thoroughly wash, rinse, and dry all areas. Let's look at example number 1. After the helper places the wash basin filled with water, soap, a washcloth, and a towel on the bedside table, Mrs. L washes, rinses, and dries her upper body. She asks the helper to wash, rinse, and dry her back only. The helper removes all of the items once Mrs. L is done. What is the care rating level for Mrs. L? The best response is setup or cleanup. The helper provides setup assistance. And remember that assistance with washing the back is not considered when rating this item. Example number 2 is Mrs. O. She is recovering from pneumonia. After the helper places the wash basin filled with water, soap, a washcloth, and a towel on the bedside table, Mrs. O washes and rinses her upper body, but she is too fatigued to dry herself completely, and the helper notices her oxygen saturation levels are at 86% after she finishes rinsing herself. So the helper dries her off and removes all the items. What would be the care rating level for Mrs. O? The best response is 3, partial or moderate assistance. Mrs. O was able to complete 2 of the 3 activities in washing her upper body, but could not completely dry herself, which required the helper to provide less than half the effort to complete the task. The next item is showering or bathing. It is defined as the ability to bathe oneself in a shower or tub, including washing, rinsing, and drying themselves. Note that this item is not about transferring in or out of the tub or shower, and it is not about washing the entire body outside of a tub or shower. So a few tips for scoring are to always remember the patient's usual performance, and if there are orders to not get these areas wet and the rating cannot be inferred, the rating would be NA. Also, if the patient doesn't have bath or shower facilities at home, and this task is not going to be a goal, then the response would also be an N. The rating scale is on page 12 of your training manual. A patient would score independent if once in the shower or tub, they can wash, rinse, and dry themselves without any assistance from the helper. So even if they required maximum assistance to get into the tub, and if they used a shower chair and grab bars and bath mitt, that does not factor into their score of independence in bathing or showering. They can wash, rinse, and dry themselves without any assistance. Let's look at example number 1. Mrs. L stands while showering herself due to hip precautions. She washes and rinses herself, except she is not able to safely reach from her knees down to her feet and requires a helper to assist with this part of her care. Mrs. L sits on a raised toilet seat to dry herself, except her feet. What is the care rating level for Mrs. L? The best response would be partial or moderate assistance. The helper is assisting with less than half the task, but Mrs. L washed her body, except from the knees to her feet, rinsed her entire body, and only needed assistance in drying for her feet. The next example is Mr. J, who sits on a tub bench as he washes, rinses, and dries himself. The helper stays with him to ensure his safety and provides lifting assistance as he gets onto and off the tub bench. What is the care rating level for Mr. J? The best response is supervision or touching, because the helper is providing supervision only as he washes, rinses, and dries himself. Again, the transfer on and off the tub bench are not factored in to your rating. The next item is putting on or removing footwear. It is defined as the ability to put on and take off socks and shoes or other footwear that is appropriate for safe mobility. This item, however, is not about the ability to put on and remove anti-embolism or compression stockings. A few tips for scoring to keep in mind, especially as it relates to the anti-embolism stockings, are that if a patient needs help getting those on, but is independent with everything else in the item, they can still score a 5, setup or cleanup, because that would be their maximum possible score. Someone has to set them up for putting on their shoes and socks, and that setup part is the putting on the anti-embolism stockings. Another key tip is that if a patient is a double amputee or even an amputee who will not be a prosthetic candidate, then the score for this item would be an N. The rating scale is on page 13 of your training manual. A rating of substantial assistance would be given instead of dependent when the patient does participate in the effort to put on or take off footwear. For instance, the patient is able to bring the sock or shoe to the foot, but is unable to pull them on and snugly fit them onto the foot. Or, once the helper starts the sock, the patient is able to pull it on up, and the patient is unable, however, to assist with the shoes or the footwear. Or maybe the patient is unable to assist with the socks, but once the helper fits the shoe or footwear on the distal part of the foot, the patient is able to slip the entire foot into the footwear. Let's look at example number 1. Mrs. K sits on this side of the bed. The helper puts her slipper over her forefoot and then instructs Mrs. K to pull the slipper over her heel. Mrs. K is able to do this, and the process is repeated on the other foot. Mrs. K is able to get the slippers off her feet without assistance. What is the care rating for Mrs. K? The best response is partial or moderate assistance, because the patient requires assistance from the helper to start the task, but once the slipper is started, the patient can complete the task. Example number 2 is Mrs. G. She has orders to wear compression stockings when out of bed to control her lower extremity edema. She cannot get them started on her own, but once the stockings are over her ankles, she can assist with pulling them up and smoothing them. After her stockings are on, she is able to put her slippers on without assistance. Mrs. G occasionally requires assistance to remove her stockings, depending on the amount of swelling she has had. So what is the care rating level for Mrs. G? The best response is setup or cleanup. The patient requires assistance, but only to get the compression stockings on or off. And remember, this item does not include the amount of assistance necessary to put on and remove anti-embolism or compression stockings. If a patient is unable to get them on and off independently, their maximum score for this item is a 5. If a patient can get them on and off independently, their score would be a 6. Now let's take a patient example that involves more than one item and put it all together. Mr. F is referred to OT. On evaluation, the patient is able to thread his affected arm through a shirt sleeve that the helper places over his head. He leans forward, the helper pulls the shirt down over his trunk. Mr. F is then able to lift his legs off the floor to allow his legs to be threaded into the pant legs. He needs greater than 50% support from the helper to keep his balance, while he uses his left hand to pull up his pants. Once seated at a table, the helper opens up his containers and prepares his food. Mr. F uses a fork and a spoon in his left hand to scoop his food. He needs occasional touching to ensure he scoops the food entirely on the fork, and occasional steadying to keep from hurrying the fork to his mouth, which causes the food to fall off. What is the care rating level for upper body dressing, lower body dressing, and eating? The best response for upper body dressing is 2, substantial or maximal assistance, because the helper provides more than half the effort of achieving the upper body dressing activity. The best response for lower body dressing is also a 2, because the helper provides more than half the effort to achieve the activity. The best response for eating is supervision or touching, because the helper provides only occasional touching to steady the patient's physical movements, but the patient can complete the task. A few closing reminders. Every effort should be made to score all items with a 1 to 6 rating. Use your clinical judgment when assigning the scores. Perhaps there are some tasks that cannot be attempted because the patient is actually dependent in those areas. The correct response then would be dependent rather than not applicable or not attempted. Even if a patient task or activity is not going to be the focus of your therapy program, you still must score those items, because these functional measures are not being looked at as individual items. The care item scores add up to be a composite score of the patient's overall function. So if items are left not scored, the patient's overall level of function will be lower than it should be. Now it's time to take your test. As stated earlier, all occupational therapists will be required to complete this post-test, which tests your knowledge of the rating definitions and alpha scores and the item definitions. Some physical therapists will be required to take this test, so be sure to check with your organization. Most therapists will take this test electronically. You will find the electronic link provided in your training manual. However, some companies may choose to test therapists using other methods, such as paper and pencil. So if you don't find a link in your manual, check with your managers. For those of you completing the electronic test, complete Section 2, Care Items, Self-Care Questions, which consists of 8 clinical scenarios and 18 total questions. You are required to score no less than an 80% to pass the test. Your score will be displayed on the last web page after all questions have been completed. You can use your training manual and any notes you took during this training to assist you, but you will be required to take the test again if you don't score 80% correct, but you can take the test as many times as you need to. This concludes the self-care training module. Good luck.